Hi, my name is Audrey, and I'm going to go through the irritable bowel syndrome presentation that I made here for class as quickly as I can because I am on a timer. Let me set my timer for a minute. It'll go off when I have 1 minute left because YouTube only allows 15 minutes. Okay. Irritable bowel syndrome, IBS, is a condition of the GI tract disrupting the regularity and consistency of bowel movements. It usually consists of abdominal pain, a change in bowel habits, and a change in bowel consistency. And it also is usually feels better once, like the change in the abdominal pain usually is relieved with defecation. Miscommunication. It is a miscommunication between the brain and the bowel, leading to motility disturbances, visceral hypersensitivity. This is not allergy hypersensitivity, um, and a change in the central nervous system engagement. IBS is not, the pathophysiology is not fully understood, but there are a couple of possibilities here that obviously they have been studying. Uh, let's see. So studies have shown that increased GI motility during times of anger, aggression, stress, and then decreased motility during times of depression. That's why there is a high correlation of those with psychological issues or mental health issues. With people with IBS usually have some of these issues. Organ sensitivity. Patients are somehow hypersensitive to peristalsis and other smooth muscle contractions. These are changes in there are changes in the descending sensory pathways, and there are irregular electrical signals of the smooth muscle, which is how we think that there are these people are hypersensitive to the bowels, to the bowel movements. There are three different kind of types. IBS-C, there's constipation, there's diarrhea, or there's a mixture of IBS, any of these. Let's see. It also has been found that the central nervous system and the peripheral nervous system of the bowels have a two-way street. So, like it goes, stress and all that can cause irritations in the bowels, and then bowels can also cause us to be distraught. That's the two-way street there. They have found a high amount of inflammatory cells and proteins throughout the bowel, including post-acute infection. Changes the microbiome. It activates the T cell lymphocytes, the mast cells, and all these activate the cytokines, which change the neuro control of the GI tract. That can change secretions, motor functions, and sensories. Patients who have high stress and who are post-enteric infection are more likely to develop IBS. IBS symptoms are also common in patients with food allergies. So that's why one of the things with patients with IBS are to determine if they have a food allergy. And then the most common ones here are lactose, gluten, sorbitol, and fructose that give those symptoms if there is an allergy. Let's see. Some risk factors is acute enteritis, and the ones that correlate more with IBS post-infection are E. coli, C. jejuni, C. diff, salmonella, and cholera. Norovirus is also common. Mental health issues, which we already discussed, and a Western diet and lifestyle. So people in the United States and countries who are adopting similar lifestyles and diets as the United States are more likely to have IBS symptoms, probably because of all the highly processed and all the crap we put in our food. Let's see. People with IBS have been found to have a lower diversity of good bacteria, and then a high concentration of clostridiols, if I said that right. There have been some genetics correlating with IBS. A lot of people with IBS have been found The serotonin reuptake transporter gene may be related to IBS due to correlational findings of a deletion or alteration of this gene, which would, let's see. However, it is still believed to be a polygenic issue as well as highly environmental. Let's see. Some studies found a higher prevalence in women, and then other studies have found like no difference between the sexes. The age range, however, is usually late adolescence to like the oldest being like 50 years. So if a patient's older than 50, let's get some more testing done, find out what's going on. Symptoms of IBS, we already talked about. Abdominal pain, it's usually going to be the lower left quadrant. It can be diarrhea or constipation or both. Bloating, more than 3 bowel movements per day or fewer than 3 in 1 week. Let's see, all these symptoms are going to be intermittent. IBS is considered a chronic illness. Other symptoms: urgency, mucus in your stool, gas, and unable to finish a bowel movement, which I would think is similar to the incomplete bladder emptying. You just kind of feel like you didn't finish going, but you're unable to finish. So your physical is mostly going to be normal. You may have a distended abdomen. The patient may have tenderness over the left lower quadrant, over the umbilicus. Some people have tenderness over the epigastric area if the small bowel is involved. Some differential diagnoses include celiac disease, inflammatory bowel disease, diverticulitis, lactose intolerance, Crohn's disease, and colon cancer. Dunphy here in the textbook, they discuss like all things wrong with the bowels are differential diagnoses. Like there was a ton, which I didn't think it was absolutely necessary to include them all here. So I got the biggies. Labs and diagnostics. Pretty much all of your lab work is going to be normal in patients with IBS. The biggest thing is obtaining a complete history of present illness is the best diagnostic tool. It's not recommended to exhaust all possible differential diagnoses due to expense and patient dissatisfaction of the approach. Colonoscopies are only recommended for patients who are older than 50 with symptoms. Also, you only want to do more testing if the patients are already diagnosed with IBS and are having new different symptoms. You always want to look into any unexplained anemia and just ruling out inflammatory bowel disease is also going to be very important. You want to get a CBC, C-reactive protein, serological testing for celiac disease, ESR, stool sample for occult blood and culture, because that's going to be something else, possibly one of the inflammatory bowel diseases. And you want to check your pancreatic enzymes, make sure your pancreas is doing good. The Rome diagnostic criteria, that's the criteria that generally they go over the IBS. It's all of these things. It's all inclusive to these things. Abdominal pain at least once a week. Change in bowel pattern, change in stool consistency, and abdominal pain relieved with evacuation or defecation. Has to be all of these things. Abdominal pain may be continuous or intermittent for at least 3 months. IBS has no biomarkers, hallmark findings, or gold standard testing. Treatments. Okay. Diet modifications. What you always want to go to first, increase your soluble fiber. Butyrate has also been shown to have anti-inflammatory effects, and it is best taken with the fiber. Increase your hydration, always. And then the FODMAP diet. This is a very, very extreme diet, mostly to rule out food allergies. So it stands for fermentable oligosaccharides, or food allergies or intolerances, disaccharides, monosaccharides, and polyols. These FODMAPs are poorly digested, and you're going to eliminate lots and lots of things in your diet. Avoid foods with fructose, sucrose, honey, sugar, alcohols, and high fructose corn syrup, just to name a few. That's not all of them. Eliminate both artificially and naturally found sugars, but not all of the sugars. For more information on this, look, I have my University of Virginia Health System reference if you want to look into that more. Limit all your fruits, limit all your veggies, and completely omit several of them, including apples, cherries, mangoes, corn, cabbage, cauliflower, but that is not all the ones they want you to eliminate. You want to eliminate most of your dairy products, including milk, ice cream, and yogurt. Omit wheat, barley, and rye, soy, chickpeas, beans, some nuts, including cashews and also peas. Let's see. You also want to cook your veggies because cooking eliminates a lot of the sugars in them. Let's see. So you're going to eliminate all these foods and then slowly reintroduce them and see if any of them cause your symptoms. Your microbiome. Many patients with IBS have low colonizations of these bacteria here. Prebiotics are non-digestible substances that stimulate growth of certain bacteria. Interesting fun fact, prebiotics are made up of MAPs. So be careful with that. Probiotics are lactobacteria used to supplement the microbiome. Lactobacillus has been found to reduce pain and gas. And by this one here, Bifidobacterium, reduces urgency and decreases overall symptoms of IBS. Many patients with IBS have an altered microbiome, and the microbiome is important because it affects bowel transit, absorption, and food metabolism. All right, last slide. Plane of care, pharmacology, smooth muscle antispasmodics. Myself here. They block acetylcholine in the smooth muscle of the GI tract, gives pain relief, and changes GI motility. I'm going to assume it slows it. Peppermint oil does a surprisingly amount of good for your GI tract. If you have IBS, it blocks calcium influx in the smooth muscle, slowing the GI muscle contractions. It is also a pain reliever by having anti-nociceptive effects for the GI tract. And for patients with severe anxiety and depression, you definitely want to treat those in general, but be mindful because tricyclic antidepressants have been shown to be very helpful at slowing the bowel movement, so they're good for IBS-D. SSRIs are good for IBS-C because they speed up the bowels. And then you have your supportive care, which is going to be your antidiarrheals, your Imodium, your Lomotil. And if diet modifications, increase hydration, exercise, fiber, if those don't work, then stimulant laxatives are going to be recommended, such as lactulose and magnesium hydroxide. Okay, I have just a little under a minute left. I hope you guys enjoyed this and have a great day. Thank you.